calling in, as a reminder, we have a presenter today, so if you're able to log on to the GoToMeeting, you'll be able to see the presentation. Hi, good afternoon, everyone. This is Keisha Pollack. We'll be getting started in another minute or so. All right. All right, so good afternoon, everyone. I heard somebody just joined. Good afternoon. This is Keisha Pollack. Just wanted to welcome all of you to this month's PAPRN Plus Network call. Thanks, everyone, for making time to be on the call today. Want to remind you that we do have the GoToMeeting link available, and we have a presenter for today, so if you're able, please log on so you can see the presentation. I want to also remind everyone before we get started, if you're not speaking, can you please remember to mute your line? Thank you. So the agenda is up on the screen for those of you who are looking at the slides. I wanted to begin, as we normally do, with updates from the CDC, and let me see if Tom is on or anybody else from the CDC who'd like to share any updates.
Yeah, I'm on, and I've just got a couple of more just general information for the larger group. And one is to remind people that we have two major funding sources that go either through state health departments or through universities. And the first is what we call 1305, and that's the major amount of money that goes to states to address obesity and physical activity. And the other is what's called the High Obesity Project, and it's mostly in rural areas, and we're going to be adding two more states to that. It's managed through cooperative extension, and so I think this is especially possible interest to the rural working group because cooperative extensions, of course, are generally in rural areas. They're getting $500,000 to $1 million per site, and I think it's probably a natural partnership with things like the Rural Working Group. If people were just to Google DNPAO, that's the initials for our division, and then look under the section for state programs, it would list the state program and a contact person, the amount, and a little description of the project. So I think there might be some synergies there that'd be worth exploring a little bit. The other thing I just wanted to mention is we have a wonderful new staff member. I think Kelly's on the phone. Kelly Cornett, who's just joined us, is especially capable in putting graphics and information together in ways that translate complex research into information for people at the local level of state health department. So, Kelly, if you're on, just say hi.
Yep. Hi, Kelly. Thanks so much for being on today.
That's all.
Great. Thanks for those updates, Tom. I just want to say our state has a 1305 grant, and that's the mechanism through which we've been actually able to partner with our research project on workplaces. So it's a great mechanism. And we will include in the notes the link that you're talking about to state programs through DNPAO. So thank you.
I'll send that to you so you don't have to look it up. But it's useful to not only know the person, the contact person, but what they say they're doing.
Okay, great. Thank you. All right, so I just had a couple of coordinating center updates to share with everyone. The first thing is that we've heard from a few people that there's a little bit of meeting fatigue. I think there's so many meetings, but people are really excited and committed to remaining engaged with the working groups, and we're really excited about that. And so one thing that the coordinating center has decided we're going to try, at least in the near future, is to really increase support to the best of our abilities to the working groups, and trying to see if we can free up some resources to do that, and also to have these monthly calls occur, the broader monthly network calls occur every other month instead of every month. And so I think with the working groups meeting monthly and this network meeting every other month, we hope that that will sort of avoid any further meeting fatigue, and just help people to continue to stay engaged with PAPRN Plus by having a touch point monthly through the working groups, or every other month through this group. And so hopefully that works out well. We will be asking for your feedback on that over the next few months to see how that's working, and I look forward to hearing from you. The second thing I want to share is that we recently, PAPRN Plus recently became a supporting partner of Voices for Healthy Kids, their school health policy consortium. So Voices for Healthy Kids reached out to us to ask if we would partner with them in this role, and really help provide input on their strategies, and help with dissemination of some messaging or other things. And so the coordinating center will help send out some information, and specifically our schools working group will be connecting with them on a more regular basis. And so the School Health Policy Consortium covers a bunch of things around school foods and physical activity and school wellness policies and water access. And I think that, again, to get to Tom's earlier point, there's a lot of synergies there between what they're doing and what that particular working group is doing. So if you see anything out from Voices for Healthy Kids, just know that that's part of our relationship with them. The third thing I want to tell everybody is that folks may not have heard this yet, but I'm excited to share that Active Living Research will be having a conference in 2017, and I was asked to let everybody know that it will be back in Clearwater Beach, Florida, and it will be occurring February 26th through March 1st, and there will be a call for abstracts released late June or early July. So please keep an eye out for that, and we will certainly send that through the PAPRN Plus email distribution list. And I'm thrilled that there'll be another ALR meeting, and I hope and assume that many of you on the phone are as well. And I encourage folks from PAPRN Plus to submit abstracts, and working groups to submit abstracts to that meeting if there's something that that they'd like to display or have considered for display at that conference. Does anybody have any questions before we transition to our presenter for today? Okay, hearing none, let me just remind everybody again to please mute their phone if they're not talking. And I will introduce our speaker, who I am really excited for. And today we have Nusheen Razani. And Nusheen is a pediatrician and nature champion, which I just love describing her that way. She was trained as a nature champion by the National Environmental Education Fund and Bureau of Fish and Wildlife in 2010. Since then, Nusheen has worked to forge relationships between parks, health, and communities for the purpose of improving mental health and physical health. At UCSF Children's Hospital, Oakland Hospital, she's part of the Fine Nature team, and in partnership with the East Bay Regional Park District, the Fine Nature team has started a park prescription and nature shuttle program at the UCSF-CHO Primary Care Clinic. Dr. Razani also serves as the lead medical consultant to the Institute at the Golden Gate, which is a think tank for the national parks, and as their senior fellow. Her other responsibilities include working as principal investigator for community-based park and health initiative in San Francisco's Baywater Huntersport neighborhood. She's also on the leadership committee for Healthy Parks, Healthy People Bay Area, and participates in the National Park Prescriptions Initiative. Some of you may have heard from Dr. Razani before, and if you haven't, you're in for a real treat. And again, I'm just thrilled that you're here with us today, and I want to encourage people, if you're not on the GoToMeeting yet, please hop on and you'll be able to view Dr. Razani's slide deck. So I will turn it over to you now, Nusheen. Thank you again for being with us today.
Thank you so much. That was such a kind introduction. It's been so fun to work with parks, and I'm really happy to be presenting today and finally be at a place where we're starting to gather some data. Although I don't have it yet to present to you, I will describe to you what we're doing. I will be describing a program called SHINE, Stay Healthy in Nature Every Day, which was developed through a collaboration between my primary care clinic and the park. And our aim was to translate the research on the health benefits of nature into a clinical intervention. Next slide. I'm going to talk a little bit about the health benefits of nature and then describe our thinking in creating our clinical intervention, describe our evaluation plan, and then I will be very happy to get feedback and have some discussion. Next slide. So there is actually a lot of research, and it's increasing, about the potential health benefits of nature across the lifespan. This is a summary slide, and I'm going to go through some of these in detail, but if we just start from the left and move around the circle, you can see that there's research on improvements in motor strength, emotions, vitamin D levels, myopia, childhood development, conservation behavior, social integration, cognition, mental health. And it's a very interdisciplinary field of literature, which I have to say the clinician component is missing, besides psychology, because there is an entire field of eco-psychology. But the clinical applications and the translational research is really lacking. By the way, the best definition of nature that I've read is by Hartig et al. In 2014, and they define it as the physical features and processes of non-human origin, including living nature of flora and fauna, together with still and running water, qualities of air and weather, and landscapes. But each of these studies has a little bit of a different definition of what they mean by nature. Next slide, please. Because this is a physical activity forum, I did want to talk a little bit about nature and the findings with physical activity. And what I've read is that in general, just being out of doors in any kind of environment leads to more physical activity. And a study quoted here is based on, is a GPS study in England following children over 5 years, and it concluded that children are 2 to 3 times more likely to be physically active out of doors than indoors. Next slide, please. And in the nature literature community, there's this understanding that there's or a belief that there's an added value with exercise that's done in a green space or that's outside and in nature. And here are some examples of the findings. Green areas on elementary schools support moderate physical activity. So while there's more vigorous activity on concrete, more numbers of children and more different types of children are active on the green areas. So on concrete, I've seen descriptions of sports and bike riding and more athletic children being vigorously active. But on green areas, higher number of children are active. There's also evidence that children develop better coordination and balance in natural areas because the terrain is not necessarily regular. And then there was a systematic review of 25 studies looking at people doing the same thing, and this was not about children, but adults, the same activity indoors and outdoors in nature, and found that exercising in a quote-unquote green environment had an added effect for self-reported emotions, such as anxiety, anger, fatigue, tiredness, and attention. And then there's a lot of work about blood pressure and cortisol. It happened that in this meta-analysis, those were not significant, but the studies were small and promising. Next slide, please. On on the causal pathway between health and nature, stress is really becoming increasingly recognized as a very important component of why nature seems to improve health. And within 15 minutes of being in a forest environment or among trees, you can see a reduction in blood pressure and pulse, which plateau, they don't keep going down, and cortisol, and that's compared to doing the same activity in an urban setting. School children living in more green environments are considered more resilient against stressful events. But let me clarify that. The negative association of stress on child health seems to be reduced for those with more access to nature. And the interesting thing is that the more baseline stress the child has, the bigger the buffering impact of nature. Next slide, please. Actually, sorry about that. Okay. And then lower levels of anxiety and other mental health illnesses have been correlated with green environments in large population-based studies. I didn't list one here, but there's studies in the hundreds of thousands that show lower levels of anxiety and actually mortality in areas with increased access to nature. Next slide, please. So time spent in nature can encourage social integration and decrease loneliness. Next slide. And there is actually a way to measure how connected you are to nature, which is a really fun part of doing interdisciplinary work. I now know the Love and Care for Nature scale. That's a validated scale. But it seems that being connected to nature is associated with well-being. And some people say that place attachment is a developmental milestone that we may be missing and not knowing what the impact is of missing that. Next slide. So there are developmental milestones that may happen in nature. And we do know that natural landscapes provide increased opportunity for free and unstructured play, which, as you know, is essential for physical activity in the young child. And as I said previously, can contribute to gross motor, coordination, development, and there's work on its benefits from emotional and social perspective. And I don't have time today, but a lot of this work happens, is found in studies comparing childhood social structures before and after preschool greening projects. Okay, next slide. So the issue is that health inequities mirror inequities in access to nature and parks. And so for those of us working in low-income environments, it's one thing to talk about how good nature is for people, and then it's another thing to figure out how to get them to nature. And when we think about lack of time, lack of access, lack of comfort, or feeling welcome, these are not things that are easy to deal with. And lack of time is different depending on your income level. For our patients, it actually means having 2 or 3 jobs and not having time. In higher income levels, it's found that it's an issue of priorities. And then I'm just going to skip to lack of comfort and feeling welcome. For many communities of color, could also be incidences of racism or perceived exclusion in parks. And I don't have the literature listed here, but this is based on the work of leisure and recreation scientists. Next slide. So we were approached by our local park district. We are an SQHC, and we see about 30,000 children a year in our primary care clinic. About 98% of them are on federal insurance. And I have to be honest that when we were first approached, the response was kind of like, yes, great, or yes, they do need nature. They also need food and housing, and how can you get it to them? It's not our job. We're clinicians. Next slide. But what happened is quite beautiful because our park district was not discouraged. And they kept asking, okay, great, well, what do you need? What would make it easier for you? And so it's been 5 years, and we thought about our collaboration in the context of health inequities and the realities of why our patients are not already in nature. And so we made this intervention, which we call SHINE, Stay Healthy in Nature Every Day. And we used their expertise in decreasing barriers with our hopeful expertise in behavior change to really think about how can nature be a clinical intervention. And we were interested specifically in stress, loneliness, and physical inactivity. Next slide. And we have 3 goals. The first is to increase clinician screening for stress, physical inactivity and loneliness, just by giving them something to give after they ask those questions. We wanted to know if that would increase the likelihood that they would be willing to talk about these issues. The second goal was to strengthen the connection between individuals and nature, and that's the behavior change piece. And this is also the piece that our parks partners were interested in, because they want more people in parks and they want a bigger diversity of people in parks. And then the third goal was to improve health. Next slide. And so these are the areas of activity that we did. The first was clinician outreach. So we created some materials and PowerPoint presentations, which we always give standing next to parks. We do our part and then they do our part. And most of the residents prefer to hear from the park staff rather than me. And then we have clinic materials, which I'll show you. We quote unquote naturalize the inside space of our clinic, because our thinking was our patients don't have time to go to nature, so please bring it to them. And then we integrated a screening question in our well child care visits. And then we were kind of really demanding partners, because then we were like, well, we need a ride and we need food and we need programming. And so we created outings for patients from clinic once a month. And I'll talk a little bit more about that. And then we recently completed an evaluation of the program. Next slide. So we asked for decoration. And at the beginning, when we asked for nature in the clinics, we really were thinking about it as decoration. But it actually has become a physician and patient prompt to think about nature and potentially talk about it during the clinical interaction. We named, there's 7 clinical areas, and they're named after local parks. And many of the patients that we serve have not been to these parks, even though they're all within public transportation distance. And we were very mindful about which parks we chose, because we wanted them to be local. And they don't have much in terms of words, because the nature kind of speaks for itself. But there are posters inside every clinic room, and those posters have a very simple map on how to get to that local park. Next slide. We also created some easy-to-read flyers with a consistent intervention that's always the same day, same time of the month. Same day of the month and the same day. It used to be to the same location, but now we're in our 2nd year now, actually in our 3rd year, and now we rotate locations just to keep it fun. Next slide. We have a short script for what doctors could say, and basically nature is good for you because one of these 4, it helps you be strong and active, it increases your well-being and reduces stress, it makes you smarter, and it brings families together and makes you less lonely. And then we try to do motivational interviewing, so really give it to people who are interested. And we now have a mechanism to sign people up. You can just order the nature prescription, and then the patient is it's scheduled as a visit for the next monthly outing. And that way we can also track how many people are talking to patients about it. Next slide. We have a journal where people can document or track their park visits. And then next slide. And then in order to make, really this was partly for the physician to make it easy for them to know what to talk about, we did ask for these monthly consistent outings. And this is a picture from one of them. And then I'll give you a little bit more detail about how those work. So next slide. So if the patient is enrolled in that clinic, then the computer does send I think it sends a letter or a call 1 week in advance. Then our staff calls the Wednesday before Saturday and texts on Fridays. Then on Saturday, patients come. We have about a 44% show rate, and when it's raining, a lot less. So we're very grateful to the parks for sticking with us, even when not many people came. One thing that we really did early on, which I'm so happy about, is that we made the prescription for the entire family. And so we gave it to the child, but really it was for the parents and the extended family. And this was based on research that nature is really, the thing that resonates across ethnic groups is the idea of being in nature with family and having a picnic and something relaxing there. And so we encourage family and friends to come, and we do eat. When they get to the clinic, they're greeted by a healthcare provider. And then in this picture, there happens to be a park staff. They're not always at the clinic, but sometimes they are. Next slide. Then we have free transportation, and if we can, sometimes we try to sing. Next slide. When we get to the park, we ask the park to give us a very warm welcome. And this is because we know that we work with disenfranchised populations and that not everybody else in the park will look like them. We wanted to make sure that they knew that these are their parks and that they're welcome. And so the very first thing that we do is a warm welcome. Next slide. And then we do some icebreaker games, often focused on the fact that we have many cultures, and so we do multi-language games, and sometimes we play tag, and then we have a picnic. And next slide. And then we do free play. And this is the part that I'm always the free play police, because someone is always trying to structure this, but we insist on having our unstructured time. And this is really great for the little ones. And then that way we don't have to struggle to try to structure them later because they're tired out from their unstructured time. Next slide. And it's a process with the parks to talk to them about allowing the children to explore and mess nature up as part of their right to have adequate human development. The picture on the bottom was us sitting on the parachute is one of the park staff leading us on a meditation where we were looking up at the trees. Next slide. We do attempt always to do a 60-minute walk and to have what's called some sort of fascination experience in nature. Next slide. And this can be, in the redwoods, it was looking up at the redwoods. At the bay, we get to see crabs. There's a lake area where we try to immerse ourselves in nature. And this is based on the literature that awe, or a feeling of just like shock and fear and also happiness, helps decrease depression and anxiety. And it's one of the more exciting parts of the nature research. But we do try to always do something that really impresses the children on how cool nature can be. And I did mention the 60-minute walk. We do our best, but we do have to tailor it to how the group is in terms of how rigorous that walk can be. Next slide. So hopefully the next time I speak to you, I will have data I can't present it yet because we just completed our randomized trial evaluating the effect of this nature-based intervention. We were interested in park visitation, and our primary outcome was stress in the parent. We enrolled 78 parent and child dyads, and I'm very proud. This is not me, but my staff, but we had 84% follow-up. We saw patients 1 and 3 months after the SHINE outings, and for people enrolled in the SHINE study, they were asked to come 3 weeks in a row to 3 family outings in a row. Next slide. And so everybody we've all been wondering, what do we measure? Because the literature on nature is so interdisciplinary, and some of it is about things like awe or things that we don't really have clinical correlates for. And so we, I'm sorry, there's a typo here. We had some public health students really think about it for us and make a survey instrument. And this is what we ended up measuring. In terms of clinical practice, we're measuring what physicians do and what they screen for. In terms of patient behavior, we're using that journal to document park visits, although that's a learning process for us to see how many of them actually brought their journals back. We also asked for 1 week recall on how many times they went to the park when they came in at their 1 and 3 month follow-up visits. And then for health outcomes, we used a validated scale for stress and biomarkers. And then we did pedometry and 1 week recall for physical activity. We measured BMI, and our total number of patients with ADHD may not be that high, but we did measure their behavior. And then we did our best to find ways to measure loneliness, family cohesion, and some of the other psychosocial outcomes, which I'm happy to answer questions about. So that's it. I want to say a big thank you to our park partners, because they're the entire reason all of this is happening. And we also received funding from National Recreation and Parks Administration. I want to thank the amazing primary care doctors who thought of all of these things to do for their patients, and many of them go on the outings on their own time, and also Children's Hospital Center for Community Health and Engagement. Next slide. And here's where you can get some more information.
Great, thank you so much, Nusheen. That was terrific. I know I have several questions, but let me just pause and open it up to folks on the phone who have questions, or feel free to also type them if you're online, and I'm monitoring the chat box. Just a reminder to take yourself off mute if you have any questions. Well, maybe I'll just go ahead and get started. I wanted to ask Nusheen, a lot of the activities and what the kids are doing when they're outside just sounds really interesting and appealing to them. As part of the intervention, is there input from the children about what types of things they would want to do when they're outside? Or can you talk about the development or selection of those activities?
That is such a good thought. We have not done formal focus groups or questioning with the children, but we did look into the environmental education literature. There's a person named Joseph Cornell who has a 4-step process to connecting what he calls the urban child to nature. And so we based the activities on that, he starts by, actually, I didn't mention that what we do when we're at the clinic is we do a mindfulness exercise where we tune into our senses. And then the first thing that he recommends is doing something very fun and not focused on nature, and that's why we do the games. And then to have that fascination experience with something that really gets people's attention before you let them kind of reflect and be on their own. So that's what we use. We also, one of our park partners, Mona Ko, her specialty is in multicultural experiences in parks. And so she brought her experience in leading games to what we do at the beginning. And then the other thing that informed us, I think, is many of us are parents. And so we knew that if we're asking families to come into nature for 3 to 4 hours, that we had to give food. And we try to give food right away because we go at 1, and a lot of the kids are crying. So we tried to get everything uncomfortable out of the way fast. And then we spent a lot of time normalizing childhood behavior. That's probably what I spend most. When we get to the clinic, I said, this is what's normal. And when we're at the park, I try to normalize play and mess and nonlinearness. So I haven't asked children, but we try to do what we think they like. But that's such a good idea. We should ask them.
Yeah, but it sounds like you guys are getting it right by using all of those strategies. So, but yeah, thank you. Thanks.
Well, we'll see. We'll see when the evaluation comes out.
That's right. That's right.
Maybe not.
The kids look like they're very involved and engaged. So I look forward to having you back in the future to present the findings of your trial. There's a question online from Kelly at the CDC, and she asked, do you know of any similar programs around the country that exist?
I know of some really, really wonderful park prescription programs. I know that Dr. Zar is very active. I think there are many people working on this, and each one is kind of learning more about a certain component of it, and he's done an amazing job learning about how to use electronic medical records to link people with their local park, and it actually, through their system, they can print out a one-page sheet telling people about their local park. I know that there's Dr. Sagbeer does Walk with a Doc, and he's created a training module for doctors to walk with patients in parks for health, and that's adult-centered. I think that we are the first ones I think our innovation was doing something family-based, and it's because of our core mission in really protecting childhood and seeing a child as part of the family. And so we spend a lot of time thinking about childhood development and also how to support parents. And the first time I did this, what I noticed was a lot of happy kids, active kids, and a lot of moms with their feet up, like relaxing. And also talking to each other. And it just so happens that many of our patients are recruited from our homeless clinic and our refugee clinic, and a lot of them would be sharing things about housing, and so we got very interested in how this could support the family, and in doing so give the child some space. I haven't heard of anyone doing that particular combination of things.
Great, thank you.
I think now there's a website for the National Park Prescription Group, and it's definitely not comprehensive, and every day there's many, many people doing this in a lot of different ways. And prescriptions are not the only way for parks and healthcare providers to collaborate at all. I don't even think they're necessarily the most effective way, but this is what I'm doing right now.
Great, thank you, Nasheen. I have another question, but I'll pause and see if there are other questions from folks on the phone or online.
Hi, this is Sandy Slater. I actually just had a follow-up question to what you just said. You said that you didn't think this is necessarily the most effective way. Do you have other suggested strategies then?
Well, I think it depends what the goal is. If the goal is to have more human bodies in nature, I don't think that a physician's office is the best recruitment strategy, because our compliance rate, even for life-saving medications, is low. And so just because we tell someone to go to the park doesn't mean they'll come. We have a 44% show rate with pretty intense. We have 2 times that we contact families, and I don't know how realistic that is. I don't know how realistic a ride and food is. So if it's a public health question of how to get more humans in nature, I think probably by making more nature and bringing it into neighborhoods and not making it, you know, an event, but a part of life, just like water and air. It should be everywhere. Okay. But if the goal is a therapeutic, you know, which I think in the population I serve, social isolation is a real problem, and stress is a real. It's gone past public health and into something that needs an intervention. It impacts the health of the child every day. And so if it is a therapeutic intervention or a preventive measure, then the doctor's office can be useful. But I think you have to think about the goal, because there are public health ways to do this outside of the doctor's office.
Okay, thanks. So you said you had a 44% show rate. Did you actually ask? I think I missed it or you may not. I don't know if I missed it or you didn't say it. But did you measure or ask the participants if they regularly visited parks or how often they visited parks before they started the intervention?
Yes. So this isn't complete, but I can just tell you from our preliminary analysis. So actually, let me qualify that when I say 44, this is of patients in our study. And to be in our study, they were asked to come 3 weeks in a row. So it was actually 60% that came ever once out of those 3, but 44 that came at least twice. And we did on the surveys ask at baseline, how many times a week do you go to a park? And I believe, I'm not done yet, but I believe the answer is going to be between 0 and 1.
Okay, thanks.
At baseline, yes. And we happen to split it into urban parks versus more natural parks, and there were definitely more visits to local neighborhood parks.
Great, thanks for that question, Sandy. Are there other questions for Nusheen?
And just going back to the therapeutic uses of nature, I mean, I think vulnerable populations, in addition, you know, in many ways in terms of income, but also in terms of special needs, that's a population that could definitely benefit from time in nature, both physical and mental special needs. Those are populations that we're seeing more and more literature on how they may benefit from nature, and new mothers and young children.
Nusheen, this is Keisha. I wanted to just ask a question. I mean, clearly you're thinking about vulnerable populations and equity issues as you talked about in your presentation. Can you just say a little bit more about some of the challenges in getting at those issues? You mentioned lack of time, access, or comfort in terms of engaging some parents who maybe, you know, this isn't part of what they would think about. Can you just talk a little bit about some other challenges and the best ways that you've found so far to really overcome those challenges?
I'm incredibly humbled by the barriers. So one great thing was that we asked people to come when they didn't show up. And they may be exaggerating because we asked, but the reasons were, examples where I had a stroke, my cousin was incarcerated. They were big reasons for not having time, leisure time at all, much less leisure time in nature. And those are 2 small anecdotes. There's a wide range of reasons why people couldn't come. But I think that the issue of how can you have time to be outdoors and relax is a really big one, and it's a much bigger one than a prescription can handle. There's another layer of complexity, which is the issue of being of color and being outdoors and which children are allowed to be free and which children have more rules around how they can act. And the things that I'm saying now I haven't been able to quantify, so I hope I'm not saying these are some of my hypotheses. many of our families are refugees, and so some of them actually went through jungles or water or nature to get to the United States, and so nature is not always a restful, good memory, and that's something that was just very eye-opening. And then there's the other issue when you're working with people who are displaced, and they used to have a very intimate relationship with land, one where they had agency and were farming it or felt ownership, and now they're displaced and you're telling them, well, go to a park and just be a visitor there and don't touch anything. And so that is also doesn't sound right. So I don't know how yet to deal with it, other than I did see how healing it was that we listened and we were present and we asked. And we did not assume that people of color or people who don't have money don't have a relationship with nature. We did measure nature affinity at the beginning, and it was super high. And many people are just one generation removed from nature. And so, I mean, if anybody has time to come and help us, we would love to do a storytelling project or something to really understand what it is, because we're talking about place and power, so it's deep stuff. What has helped, and we asked of the parks, is that issue of consistency, and to not leave our program or not defund it if we have a month without participants, because it has to gain trust and acceptance in the community. And if we're not, if people can't make it 1 month because they're having an emergency, then they can come next month. And so now we have some families that have come 6 times. I hope that was helpful.
Yeah, it was. Thank you. Thank you. Are there any other questions for Nusheen?
Oh, and one thing is that we need community-based organizations. I mean, I don't think it's enough to have the park in the south, because of those issues that I was talking about, where we need to be part of something bigger. Mm-hmm. That would be the next step.
Yeah, it's a great reminder. Okay. All right, well, not hearing any questions or seeing any other ones online, I just want to say thank you. Thank you again for presenting today. This was very interesting, and I'm really excited to see the findings that's going to come out of your research looking at the impacts on the dyads, and we definitely welcome you to come back in the future when you're ready to share some of the results.
Thank you so much. Thank you. I look forward to it.
Yeah, thank you. And as I mentioned, we do have a working group around parks and rec, and we look forward to your involvement in that working group if your time allows.
Yes, please email me. I would love to help or to learn more about what the group is doing.
Great. Thank you.
Okay. Thank you. Bye.
All right. So let me turn it over to Eric.
Hi, can everyone hear me?
Yep.
Perfect. So for anyone that doesn't know me or hasn't received any of my emails, my name is Eric Schulman, and I'm the Communications Associate with Johns Hopkins, and I've had the pleasure of working on PAPRN Plus's new website. So I just wanted to take some time to outline the new site and let you know that if you see anything throughout this brief presentation that you'd like changed or amended, please just feel free to send over an email. My email address is eschulm2@jhu.edu. Just let me know what you'd like changed or updated, and I'd be happy to make a change. I've already had a few requests for updated content, and it's a very simple process. I'm happy to make those changes. So what you see right here is the full PAPRN Plus website URL, and it's a pretty lengthy URL, so we've actually created a vanity address as well. So if you type in www.jhsph.edu/PAPRN, it will take you to the network site, and let me switch screens so you can see that. So here is the new and improved PAPRN Plus website hosted on the Center for Adolescent Health page. So here you will see our beautiful brand new logo, as well as an overview of the network, our official language, followed by an opportunity for individuals to sign up for the network mailing list and join monthly calls. If you click on these links, that'll take you over to the sign up links. We have an area for resource spotlighting, where if we have any content that we are putting out, here is where we will have the opportunity to feature that. Right now, we just have our physical activity plan toolkit embedded here, and if you click on the link, it'll take you to a download page. But anytime that we have any content that we'd like to put up from a resource perspective, we can include that in the resource spotlight on the home page. Going down further, we have just an recent news and events information, any network participation, conferences, updates. This is where we will be featuring it on the home page. And then finally, like I said before, as research comes out through the working groups, we will be able to include it here in the research highlights area of the home page. And then if you look to the left, you'll see that we have a few different subpages on the PAPRN Plus page. You have About Us, Calendar, Membership, Research, Resources, and Working Groups. So I'll just real quickly, as we're approaching 2 p.m. Eastern, go through each subpage. So as you can see, in About Us, users can learn more about the network with its mission and vision, as well as the definition of physical activity policy. And then the calendar is actually a Google Calendar, which is a helpful tool to document upcoming events and calls for and by the network. Right now, it has all of the network calls and working group calls through 2016, although I'll be updating that to represent the bi-monthly network calls. But you'll be able to scroll month by month and see exactly when each call and each meeting is taking place. Then on the membership page, all of the different types of members are defined, from coordinating center, collaborating center, affiliate centers and partners, and then advisors. And it serves as basically a directory for contact information. So if someone needs to get in touch with someone at the coordinating center level, they can reach out to them. Their email address is identified there. And then you can also see that we have these sublinks available on the left for coordinating center, collaborating, affiliate centers, and advisors. Currently, our research page lists the network's project profiles and links to the corresponding universities, but again, as content is produced, this is where we will house new findings. And the resources is constantly being updated. I've been retroactively adding content from the PAPRN Dropbox, but right now, you'll see, for example, we have network call resources and working group call resources. So the network call resources include audio from our monthly network calls, as well as presentation slides and call notes when they're available. And then also some working group call resources that I pulled from the network Dropbox. But if anyone at the working group level has working group content that they would like to add to the resources page for the PAPRN Plus site, feel free to send over an email to me, and I can very simply upload that to build out the working group resources page. And then finally, our working group subpage lists all of our working groups, when they meet individually, and then links to profile pages for users to learn more about each working group. And that includes information on the mission, short-term and long-term goals, as well as the working group leaders. And then I also wanted to take this time just to briefly mention that we've created, although we're not actively contributing to content, on our Facebook and Twitter pages, available at facebook.com/PAPRN+ and twitter.com/PAPRN+, and I encourage everyone to like and follow both pages if you are active on those social media networks. Right now, they're solely being used to post interesting physical activity news from the field and any updates that we have internally. But as we continue to grow and put out content, we'll be highlighting our network news more as well. And then also, as I wrap up, the finishing touches to the PAPRN+ site and social media channels, I'll be sending out to the network some sample social media posts that our network members can use on Facebook and Twitter to encourage their friends and colleagues to visit the site, and then also to like our social media channels. So be on the lookout in your inboxes for information on how to send a simple tweet or Facebook post about taking a look at our new network site and social media pages. And then again, if there are, sorry, as I pull back up to our PowerPoint slide, if you have any questions or would like anything changed on the website, please feel free just to send me an email at eschulm2@jhu.edu, and I would be happy to make those changes.
Great, thank you so much, Eric. That website looks fantastic, and just so everybody knows, you know, we developed the website from scratch, and so I really want to applaud Eric for his time in doing that. And the calendar function is great, because I have heard from a few people, you know, trying to how easy or where can they get the information on when all the calls are. So thank you so much for putting that up there and keeping us organized. And I want to echo Eric's comments that if you have any suggestions or additions or changes, please contact us and we will happily consider them and an update as necessary. So I'm looking at the clock, and I want to just thank everybody. I mean, it's really been a terrific call, and we really, hour moved very quickly today. And again, I'm grateful to all of you for being on the call today, and thanks again to Nasheen Mirzani for presenting today. I want to remind everybody again, our next call will be in July. I will send out an update to the calendar appointment so that it shows up on your calendar every other month as opposed to every single month. And again, we're doing that so people will not feel meeting fatigued, but also will hopefully spend more time engaging with the working groups. And as I said before, we are at the Coordinating Center seeking ways to identify resources to help support the working groups so that they can continue with their great work. So I just want to thank everybody for being on the call, all the working group leaders, and look forward to speaking with folks in July. So look out, we'll send the minutes from today's call out as soon as possible. And again, thank you so much. Take care.
Great job. Bye all.
Bye, Tom.